Juliana Giacomini is on a lung transplant waiting list. She has an autoimmune disease attacking her respiratory system. The coronavirus, already dangerous for a patient in her condition, became even more of a reason for her anguish because of a dramatic drop in organ transplant procedures over the last few months.
A gente paciente, a gente acompanha, né, a lista, né?
As a patient, I follow daily the queue for organ transplants, because sometime you get to see your name move up in the list. But with the pandemic, it clearly stopped moving up. It's sad because it takes away your hope, and that's what keeps us going.
According to the Brazilian Association of Organ Transplants, such procedures dropped by 61% between April and June this year compared to 2019. The death rate among people on the official waiting list for organs grew more than 44% in the same period.
Mas isso não foi homogêneo.
There were deep differences in this according to the region of the country, as it happened with the pandemic itself. And we noticed that the worse the curve of the pandemic was, the harder it was to harvest organs. Communication with the patients who needed the organs and the family of the donors became more difficult.
There are a number of factors behind the drop in transplant procedures, among them organs infected with the coronavirus, hospital postponements of medical procedures, and even logistical difficulties caused by the reduction of airline flights. The challenge now is to get these life-saving surgeries back on track.
In an effort to make up for the slowdown, the government boosted its yearly organ donation campaign, this year called Donate Organs, Life Needs to Go On. The medical coordinator of the organ transplant program at São Paulo's Albert Einstein Hospital hopes that practices developed during the pandemic will help boost organ transplants in the long term.
A forma de comunicação entre as instituições e entre os médicos.
The communication between doctors and hospitals improved with the development of telemedicine, and the possibilities of examining patients remotely also increased. So candidates who need organs and needed to travel to a different state to have a first assessment may benefit from telemedicine technology at the beginning of the process.
Before the COVID-19 pandemic, organ donations in Brazil had been increasing slowly for a few years. Doctors hope that COVID-19 won't be but a brief interruption for those who are on the organ waiting list. Paulo Cabral, CGTN, São Paulo.